Hi, it's Dr. Shannon from Choice Restorative Medicine. And I wanted to talk to you a little bit today about the relationship between medical providers and alternative medical providers like the chiropractors that we have in our practice. Sometimes my clients will ask me, why do we have a medical provider on staff? And it's kind of a complicated answer, but it's also a really simple answer. I started my practice 22 years ago, and at that point in time, integrated practices weren't really very mainstream, although now in the United States, you see lots of different ways that people have integrated alternative medicine and traditional medicine in one space. But for a long time, people had the impression that doctors, medical doctors and chiropractors really were at odds versus being on the same page. And that was true for a long time, especially in the early 1900s when there was a big political fight between the American Medical Association and chiropractors. And it all, fleshed out actually in a lawsuit that went to the Supreme Court of the United States, where at the end of that, basically, medical schools were taught to teach their doctors to cooperate with other types of healthcare providers, and then a lot of that animosity and a lot of that misunderstanding sort of went away. And I think if you ask any healthcare provider that's worth their weight in being a healthcare provider, at the end of the day, the most important thing is taking care of patients and making sure that the people that you are entrusted to take care of get better, or as better as you can get them, and that they are treated ethically and that they're treated in a way that's cooperative and that fits their own personal philosophy, and that their opinions are respected and heard. Just the whole well-rounded approach to treating a human being. So as we went through our practice life, one of the things that was really hard was if we had a patient where they needed medical treatment or could benefit from that in addition to their alternative medical treatment, there was almost like a disconnect where we didn't have that in our practice. So the patient would go back out into the world to their primary care doctor, to a specialist, and they would be getting XYZ information, and we would get part of that back, and it was really hard to coordinate the treatment. And patients benefit greatly from coordinated treatment where everybody's on the same page, and you make sense of things, and it's logical. So instead of continuing to fight that battle and have all that disconnect, we decided to specifically add medical providers to our team who were special in a couple of ways, right? So, we didn't want a medical team that was going to push a lot of drugs on our patients, because we know that people typically take too much medicine and there are a lot of side effects. So we wanted providers who were going to choose, if they did have to use medication, that it was minimal and for short periods of time, and that the end result wasn't that the patient was on medications indefinitely. We also wanted a provider who wasn't going to use opioids or narcotics, because we've seen where that has taken us as a society. It's so problematic now, and we wanted providers who were actually going to be able to work on restoring the patient to function. So it's one thing to get somebody to have less pain or less symptoms. It's a whole other thing to be able to get them to where they can do what they want to do, right? So somebody with back pain, you can take, enough medication or get enough adjustments that it just doesn't hurt as bad anymore. But if that same person tries to go to their kid's baseball game and they stand too long and they hurt for 4 days afterwards, they're not really better. So we really wanted to find those providers who were on the same page as we had been for 2 decades, and actually getting the patient to where they can do what they want to do. So it's, we were very, very picky about that. And now, it's nice being able to watch everybody work together. In particular, I think the professions across the board, whether it's in our practice or out in the world, have become increasingly cooperative, because more people, as they're aging, are looking for things that they can do to help keep their body functioning and to not be on drugs and to not need surgery. And you need a medical model that supports that. And I think the medical model has been so bogged down with the fallout and the after effects of, overprescribing painkillers and being pushed to prescribe pain medications. And, they want their patients functional also, and they don't want that pressure, and they don't want to see those rates of use continue to climb. So between the two of them, I'm happy to say, during my professional tenure, I have seen, lots of different types of professions be able to come together together and work cooperatively, and that's only been in the best interest of the patient. So if you haven't experienced that type of healthcare model where you have different providers who do different things, but everybody's on the same page and supportive of you, I think you should. I mean, who doesn't want that, right? So, that's what we try to provide here. And really, every day we work harder and harder to make that even more accessible to more people. So that's kind of the why behind why we do what we do and why we added our medical providers. If you have any questions, you can call or email the office or comment on our Facebook page. But I look forward to teaching you more about what we do, and I look forward to maybe someday meeting you. Take care.